Advanced care at home is like bringing the hospital to your home. We bring nurses, community paramedics, the therapists, mobile diagnostics, and if you need blood work, we can do that in your home so that you can sleep in your own bed, be with your loved ones, and be surrounded by the things that you enjoy.
I'm ecstatic. I can only dream about having somebody with me like I have here. I have a hospital in my house, and I get the same care as if I was here. And that's so important to me. It just makes it more comforting for myself and my children.
To be able to be at home, do the things he needed to do in his home. People could see, you know, Frank, can you go into the kitchen? Let's cook. You know, he got to be at home and do those things so they can actually see, are you going to be safe here? Are you going to be able to take care of yourself? And that was really important for me.
It gives a lot of people more room, wiggle room, that they can be in their own home, which to me is sort of my safe place. I feel comfortable there. I feel safe there. So, yeah, I'm very happy that I've been given this opportunity.
It meant a lot, and more than a lot. The thought of sitting in a hospital room with fairly good health, I mean, it felt pretty good. The thing of sitting there for 23 hours and 50 minutes, it just didn't excite me at all. And beside that, it was the visitation rights were very stringent. And I don't think she could have come in and stood by me. So it meant an awful lot.
I think that advanced care at home is really unique because it allows the opportunity to essentially be at our patient's bedside 24/7. At the push of a button with our technology, our patients can connect to us instantaneously, which is really reassuring for them.
In advanced care at home, we stay with the patient for up to 30 days. So there's an acute phase and a restorative phase. So that allows time and treatment to come together to care for the patients based on the individual patient needs. That's very valuable, the value of time and working within the patient's environment.
When we told our children that we were going to be doing this, they said, "You're going to take him home right after surgery," you know, because it was only a couple of days after surgery. They were worried that what if something happened, and because none of our family lived close, and what would happen to me if he fell or if something happened. I said, I can call for help right away. I can push the button. He's wearing the button on his wrist. And I said, I'm not worried. They'll be here. There's a lot of people in this team, and somebody would come and help if I needed help.
Advanced care at home is special because we really get an inside front row seat to what the patient is going through in their life. So every day they invite us in through the video, as well as people coming into the home, and we can see exactly the barriers that they may be struggling with.
All of the services you could think of that you would get in an inpatient level of care, we provide and go in the home. And they work in concert with the command center to transform hospital level practice into a patient's home.
The command center is really where the magic happens. When our patients want to connect with the command center, they can connect either through the iPad, the personal emergency response system, or through a one-way telephone. And immediately they'll be connected with a Mayo physician, a Mayo advanced practice provider, or one of our nursing team members.
It's the exact same care, but it's in the comfort of your own home, and that, you can't beat that.
It's a well-run, thought-out program. I know the nurses and the people that have been here said they had been training for months and working on this so that they could have everything tried to think of everything that, you know, could go wrong or could happen, or that they're ready to handle this. And I think they've done a great job. The whole program seems very organized and well run, and we would recommend it to anybody. We really would.